Hello everyone. Today we are going to take the skin off of our cats. So I am going to follow your lab book. You should be in the cat version. This is dissection exercise 1. You will be doing the removal activity 1, which is preparing the cat for dissection. So you'll be doing this page, this side, as well as the back of the page. And I'll be reading through this and helping you, guide you, so that you have an idea of how to take the skin off of your cat. Now I have a dissecting tray. You guys should all have mats that you received with your cats, which is fine. Some sort of table or flat surface. Gloves if you would like to wear gloves. You don't have to. I don't always wear gloves. Sometimes you can feel the difference between tissues better if you don't wear gloves, although it does kind of leave a smell on your hands that takes a day to get out of. It's really up to you. All right, so for activity 1, it says preparing the cat for dissection. The preserved laboratory animals purchased for dissection have been embalmed with a solution that prevents deterioration of the tissues. The animals are generally delivered in plastic bags that contain a small amount of the embalming fluid. Do not dispose of this fluid when you remove the cat. The fluids prevent the cat from drying out. It is very important to keep the cat's tissues moist because you will probably use the same cat from now until the end of the course. Yes, you will be using the same cat. If you would like to get rid of the fluid, you can. It's non-toxic. It's actually formalin, not formaldehyde, so it's not toxic. You can drain it down the sink, although I don't want to advocate for doing that, but it should be safe. If you would like to keep it, you can put it or drain it into any kind of empty cleaner bottle that has a spray so that you can spray the cat if it tends to get dry. If it gets dry, especially with the muscles, if you think of dried meat kind of making jerky, I know that sounds awful, but that can happen. So if you want to save the fluid and put it in a spray bottle, that will help keep the muscles nice and fresh for you, as well as the insides when we get to the internal organs. So first, on how to remove your cats from the bags. So they should actually be double bagged. They should have a rubber band, so you want to take the rubber band off. You can take the second bag that has your cat out. Okay. Now this bag should actually be kind of vacuum sealed. What you want to do is hold the bag upright as much as you can so that the fluid is all at one end and you have a little bit of a space at the top of the bag. You're then going to take a pair of scissors, like these, or any scissors will work, and cut across the top. That piece you can throw out. You want to save both of your bags. That will help keep the cat fresher, as well as help to hold in the smell a little bit, especially if you don't have a lid for a tote or wherever you are keeping your cat. Now once you remove the top and you have an opening, you can either drain the fluid out, whether you drain it into the sink or you drain it into an empty bottle is up to you. So I'm just gonna take my bag here, and lean it over and kind of drain out what I can. And at this point, since they are new, they should actually be, pardon my expression here, rather juicy. And then you will pull that out onto your mat or your tray or whatever you are using. Again, you do want to save both bags. Now, there are a few things that you will notice. First off, with mine has already been skinned. I did not get an extra one that is fresh, so this one is actually already skinned. But some of the things that you will notice on yours. So all of the cats, for the most part, have a sponge in their mouth That is to keep the mouth open so that we can see some of the internal structures inside of the mouth later when we get to some of the internal portions. Other things that you will notice is that there is an incision on the ventral or belly side of the cat down by the ankle. There's also another incision in the neck area. These cats have been double injected, and those two incisions are where the injections take place. They are injected with a latex dye, which is going to help label the arteries and the veins. When we get to that area of the dissection, all of the veins will be blue with a rubbery latex injection, and all of the arteries will be a pink-red color. That way you can distinctly tell the difference between the arteries and the veins. Now I am going to go through how the book goes through the removal of the skin. However, you may choose to do it in a different way if you would like. Pardon the puns and the expressions. There is more than one way to skin a cat. That is not just an expression for us here. It is actually a reality. You can skin it in multiple different ways. Now your book says to put the cat on its ventral side, which means you're going to take the cat and put it belly side down like this. So you can see the head, the mouth is facing down, and the neck would be facing up. Okay, so it says don disposable gloves and safety glasses. So if you have safety glasses, you're welcome to wear those so that there's no fluid that splashes up into your face and eyes. Dissecting tray, which you can use a tray if you have one, or your mats. Dissecting instruments, so you will need your scalpel, your probe, and if you would like to, I know we didn't give them to you, but if you would like to, you may use some scissors. And a name tag. You do not necessarily need a name tag because you are keeping them all at home. If you would like, you may name your cat. A lot of people do name them. If you do name him, you can keep your name to yourself if you like, or you can write it on the outside of the bag. Whatever you choose is fine. So using a pencil, mark the name tag with the names of the members of your group. Again, we're not doing these in groups because of all of the restrictions that we have right now. So you can name it however you wish. Number 2, to begin removing the skin, place the cat ventral side down on the dissecting tray or on your mat, cutting away from yourself. Again, we're going to use good techniques as far as cutting away from ourselves so we don't cut ourselves with sharp instruments. Cutting away from yourself with a newly bladed scalpel, make a short, shallow incision in the midline of the neck, just to penetrate the skin. From this point on, use scissors, continue to cut the length of the back to the sacrolumbar region, stopping at the tail. So the way that your book has you taking the skin off of this cat is by the back of the neck here. Now this is where cats can pick little ones up. So remember, this is very, very thick in the back here. One of the things to remember with dissection, you can always cut deeper, but you can never put something back on. So even if it takes you a little bit longer, it's better to cut shallow than too deep. Because once you cut something, you cannot fix it. You can't take duct tape or super glue or Gorilla Glue and it will not stick back on. So it's better to be more cautious than to get a little overzealous and cut too deep. So if you're going to follow the book, make a little incision in the back of the neck here just to get through the skin. And they have you using scissors, but you can use your scalpel too. If you use scissors, they want you to cut down the length of the back until you get to where the tail is. So then you'll have a nice incision all the way down the dorsal back line, kind of like along the spinal cord of the cat. To begin, so we did that. Number 3, from the dorsal surface of the tail region, continue the incision around the tail, encircling the anus and the genital organs. The skin will not be removed from this region. So we are not taking the skin off of the tail. You want to circle around that. And if you have a male, you may also cut around the genitals of the male as well. You do not have to take the skin off of those. Before you begin to remove the skin, check with your instructor. He or she may want you to skin only the right or left side of the cat. I want you to take the skin off of the entire cat, so you do not have to do just one side. We are going to be doing both sides. Beginning again at the dorsal tail region, make an incision through the skin down each hind leg to be skinned nearly to the ankle. Continue the cut completely around the ankle. So what you're going to do is continue that incision that you made down to the tail, and you're going to continue that down the leg until you get to the ankle. Then you're going to make a circle around the ankle. You do not need to take the fur off of the foot. You're only going to go down to the ankle here. And then you'll do that for both sides, and you'll also do it for the front arms as well, cutting down to what would be the wrist and exposing that. Return to the neck, cut the skin around the circumference of the neck. So we are not going to skin the face either. You're just going to kind of encircle around the neck, down the arms to the wrists. Cut down each foreleg to be skinned to the wrist. Completely cut through the skin around the wrist. So at this point, you should have a circle around the neck, a circle around the ankles, a circle around the tail, and a circle around each wrist. Wrist, ankles, tail, and neck. That is the area that you're going to remove the skin from. You can leave it on the face, the paws, as well as the feet and the tail. Now free the skin from the loose connective tissue that binds it to the underlying structures. With one hand, grasp the skin on one side of the midline dorsal incision. Then using your fingers or a blunt probe, break through the cottony connective tissue fibers to release the skin from the muscle beneath. So you will be able to see, once you start opening this incision and removing the skin, there will be these cottony, it kind of looks like a cotton ball, cotton swabby kind of tissue. You want to separate that from the muscle underneath. Okay, so your skin should only have kind of this whitish, silvery look to it. Sometimes it's a little yellowish. If you have anything that's kind of a pinkish gray color, you do not want that on your skin. That pinkish color, that is going to be your muscle. The more you start dissecting, the more you're going to be able to tell the difference between the tissue types. Another way to tell you have muscle is by looking at it and seeing if you have fiber lines. When you look at muscle, you can actually see the direction the muscle runs. You can see the direction of the muscle fibers. If you see that on the inside of your skin, you know you are cutting too deep and removing muscle instead of removing the skin. So you're just going to work at removing the skin from the muscle underneath. It works a little better when it's a little warmer. You don't want to bake it, but if it is frozen, it is going to be a little harder to remove. For those of you who are hunters and have ever butchered your own deer, it is not going to be removed as easily. These have been embalmed. They're not fresh, whereas with deer, if you hang them and skin them right away, the skin usually pulls right off. But with these guys, it's not going to be the same. So you do want to work carefully, making sure that you're just removing the skin and not the muscle underneath it. One thing that I have noticed as I take the skin off is that you want to pull up on the skin and then push down on the muscle with your other hand. That helps to loosen the connective tissue and muscle layers, so that when you pull up on the skin, it's actually kind of removing the connective tissue already. And then when you push down the muscle, that really separates the connective tissue from the muscle. Now, especially as you get towards the ventral area around the abdominal region, you will notice that there are some areas where you will have muscle. It's a little harder to tell. See if I can find a good area. I don't know if you can see the difference between here and here. This is all clean skin. This area has a little bit of muscle to it. Now, if you do not take the skin off or remove the skin perfectly from your cat, it is not a huge deal. Everybody is going to take some muscle off. So you can get that thought out of your head right now. You will not create a perfectly skinned cat. It's nearly impossible. The muscle that you're taking off here should be the cutaneous maximus. That is not a muscle that you need to know. It is a muscle that is in the cat, which enables the cat to move its skin, kind of like our facial muscles, how they can wrinkle their skin. That is what that cutaneous maximus is. We are not going to locate that. We're not going to dissect it. So it's okay to remove that. However, sometimes people will also remove the outer abdominal muscle, the external oblique. That is what you want to be careful of not removing. So the cutaneous maximus is okay, but be careful that you're not taking too much muscle away, that you're leaving the oblique muscles on the abdomen. So you just want to slowly work around and in between those circles until you have the entire skin removed. You do want to try to keep it in one piece as much as possible. Kind of like you're making a little rug out of your cat fur. Now, the reason that we keep it in one piece is so that you can save it and wrap your cat back in the skin to help keep the juices locked in to keep your cat fresher throughout the semester. If you choose to get rid of the skin, put it in the red biohazard bag and bring it back with you when we are completed. You do not have to keep it on, although it does keep it a little bit, pardon the word, moist, so that your muscles are fresher. A few other things. Some people do actually cut off the tail if you would like to, because sometimes it is longer and ends up going off of the tray or off of the mat. If you find that it's getting in your way, we're not doing anything with the tail, so you may choose to cut it off if you choose to. Again, you do not have to. That is completely a personal choice, personal preference. Okay. Just trying to read through the directions here to see if there's anything that I missed. Right, so that is how you would remove the skin if you are going to do it how the book has, going down the dorsal side of the cat. You may also choose, if you wish, to start your incision on the ventral side of the cat. If you choose to make your incision down the ventral side, you want to start up at the neck area where there's already an incision made. So there should already be an incision up here in the neck where one of those injections was done, and then you will make your incision down the midline ventral body. So right down the midline ventral surface, kind of like you're opening up for heart surgery. Now this way is a little bit, in some ways it's easier and in some ways it's more difficult. It's easier because you already have an incision in the neck, so if you're able to get a finger in there and lift up, you have an idea of how thick the skin is. The disadvantage to this is that most people will cut down too far, making one long incision, and they end up nicking these pectoral muscles here. So either way that you decide, make sure that you're being very careful to only cut the skin and try your hardest not to actually cut the muscle. When you get to the ventral pelvic area, you will notice there's a lot more fat down here. So there is more that you will have to cut away, and that is okay. It is going to be thicker and more full of fat. Again, once you actually make your incisions and start looking at the different tissue types, you should be able to make a distinction between the tissue types. So the superficial fascia or connective tissue that connects the muscle to the skin should be white and stringy, almost like cotton strings, cotton ball strings that will attach it. Fat is going to be very rubbery and more of like a yellowish color. Some cats will have more fat than others. Really depends on which one you have obtained. Some of you will have females that do have mammary glands. Those will be kind of a grayish color, and they will go up the ventral side of the belly here. Some of you will have males and will have male genitalia that you'll have to cut around. It really depends on which cat you have obtained. After you have removed the skin, you will be finished for this week, and then we will move on to leg muscles. So when you are completely finished, you want to take the skin and kind of rewrap it around your cat as best as you can. It does not need to be absolutely perfect. And if you did cut little pieces or chunks off, again, it's not meant to be a perfect system. So once you have him or her wrapped back up, you want to place them into the first bag. I usually hold it up like this, and then you want to take the first bag and drop that into your second bag. Now with the excess that you have at the top, usually I try to twist this a little bit, fold it down, and then secure with a rubber band. Now you may use rubber bands, you can use hair ties, whatever you have to secure the bag. You can then place him or her into your tote, your storage tote, and then you do want to clean off your dissecting tools. And now you will be ready for muscle dissections. Don't forget to remove and save your gloves if you do not have extra gloves that you can obtain or buy. If you do have extra gloves, you may throw them away. And also remember to wash your hands as well as your instruments.